Joining me now is Professor Catherine Bennett, Chair of Epidemiology at Deakin University. Thank you so much for joining us today, Professor.
Hi, Jenny.
In your opinion, do you think we should allow big events such as New Year's Eve fireworks to go ahead, or do you think it's too risky?
Look, I think bringing people together in large numbers, just getting them to the best vantage points, does pose too much of a risk at the moment, unfortunately. And it doesn't mean the fireworks themselves can't go ahead, but it's really about whether they'll allow spectators. And at this stage, I think it's too risky.
Certainly great to watch the fireworks at home, and as we certainly do year after year, but yeah, certainly from a distance this year. How likely, Professor, do you think the primary source of the case that's associated with the Northern Beaches cluster, how important is it to find that? Because we're also hearing that this particular person could have asymptomatic symptoms.
Yes, look, that's right. I think early on it was really frustrating because two reasons. One is you could have other chains of transmission that started off at the same time as the Avalon one that we're not yet aware of, and it's important to chase down every infection if you possibly can. So that's a concern. The longer we go on without seeing cases that don't tie into the cluster, then it does reassure us that even if there were some other sideways transmissions at that time, that they didn't take off and start a whole chain. So fingers crossed. That's the longer time goes on, the less important it becomes from that perspective. But equally, we really need to know just to make sure we can close that gap. If we can find any other areas where we've got risk of transfer of the virus, then we need to know about them.
And obviously we've got Christmas tomorrow. People are very concerned about their loved ones who are perhaps at higher risk. What advice would you give people? We are hearing different premiers advising people in different areas and border closures, etc. But from your experience as an epidemiologist, what would you like to tell people?
Look, the government has set with the health department what they believe to be the maximum safe numbers that you should have to your home or, come together, and whether they should just be local or they can come from other areas across Sydney. I think we should think of those as maximums, though. And so it really is about being select, spreading it across the 3 days of Christmas. If you're in those areas where they're the only 3 days you can use, then if you can use all three, that's probably better than having everyone together at once. And there are ways to do it safely. Having good ventilation, opening your windows up, or better still, being outdoors. All those things make a difference as well. But the hardest one at Christmas will be remembering not to hug and kiss people when you see them, perhaps for the first time in months. That's tough, but at the same time, that's something that's really important. Particularly if you've got older relatives, then you just have to be extra cautious. And I think, hopefully the weather's kind enough that we can have outdoor settings as well.
Yeah, absolutely. Masks are not mandatory for any state and territory at the moment. However, they are advised, certainly when we're in public areas and around a lot of people. What are your thoughts on masks being mandatory? Because we are hearing of certain other health professionals believing that they should in certain regions.
Look, that's right. We still have them as mandatory indoors in shopping centres and taxis and public transport in Victoria, and I do think that's a safe precaution. It just means even if you're exposed to the virus, if you're in those indoor settings where you're more likely, even as a casual exposure, to potentially become infected, that your risk drops. So I think, I'd strongly encourage everyone to do it whenever they're indoors, particularly those places where you can't keep your distance. It really does pay. It not only protects you, but then your relatives and your contacts as well. So if you don't become a case, it means other people don't have to go into isolation who you've been in touch with since you might have been to an exposure site. We always hear about exposure sites after the fact. That's just the way it works. So you don't know, you can't pick and choose when you might put it on because this might be unsafe. At the moment across Sydney now, everyone should just consider every time they get on into public transport or to a public shared space where there's a lot of people around, masks is the way to go.
Such important advice. And Professor, children 12 and under, they're less likely to pass on COVID, as we're hearing. So how do we compare this to what we're hearing in the UK with the impact of their new variant on children, which is being urgently investigated by scientists?
Yeah, look, we're watching closely what's coming out of the UK around this particular strain. It looks like from some of the lab work and from the data coming out of their epi investigations that it is more transmissible. And so that means if someone brings the virus to their home, not everyone gets infected, but with this strain, a few more get infected than would have perhaps with the other strains we've seen circulating before. And that can include children as well. If it's just more efficient at actually starting an infection, then those that were more resistant to that infection don't always have that same protection if you have a more transmissible strain. So we hope that's not the case. It's been really important, I guess, keeping our kids in school and knowing that at least parts of our community were safe, and not just from infection itself, but even from transmitting the virus. So let's hope it's early days yet, but if that's the case and children are being impacted more, then that's certainly reason for concern, and let's hope we can get the vaccine rolled out soon and that it works just as well on that strain as all the others.
Great, and we've got time for one quick question. We're hearing a lot about the R numbers, and they've risen in the UK above 1. Can you explain to us what the R number is and how it's calculated, and what number have we got here in Australia?
So the R number relates to how many cases there were in one generation, and then an incubation period later, how many cases then. So if one person infects, if every person who's got the infection infects one other person, then your R number is 1. You're replacing every case. And that just means you've got a steady line of, a long kind of wave. If it's 2, that means that every person's on average infecting 2 other people, and you're escalating, so that every 5 days you'll see a doubling of your cases. That's a worry. In the UK, if this strain is more infectious, then that is pushing the R number up. Even if everything else, the precautions, the restrictions stay the same, it's actually still pushing that R number up. So they've got to work harder. In Australia, we've seen that peak where we went out and actively found those cases. So it's a little bit artificial because some of this is about active case finding in Sydney. But since then, we've seen the number halve and then drop again. So if that keeps up, then we've got an R naught, an effective R number well below 1, which is what you want. It means that we're now cleaning up an outbreak rather than seeing it continue to escalate.
Thank you very much for explaining that to us and for all of your advice. You take care, Professor Catherine Bennett, Chair of Epidemiology at Deakin University, and hope you have a wonderful Christmas.
You too, Janie.